Hello everyone, welcome back to our channel StartupLanes.com. I am More Tanvi, and as you know, these are the series of interviews that we are conducting for the startup CEOs, founders and MDs. So let's get started. For today's interview, we have Mr. Bharatheesha P.L., the co-founder and director of sales and strategy of Mediimpact Healthcare Private Limited, who is a Bangalore-based company working towards excellence in the healthcare and believing pursuing business through innovation and technology. Mediimpact is the creator of Medpass, India's only healthcare mobile wallet app dedicated for usage across healthcare and wellness providers. Mr. Bharatheesha is in health industry with cumulative experience of over 15 years in medical domain health IT. Currently, at Mediimpact, he looks after the sales and strategy and overall vision of the company. Startup has also been nominated in the Bharat Jyoti Award, also nominated for introducing and enabling healthcare technology, leads the major project of DEBEL, implementation of telemedicine and India Navy ship, also submarines and hospital projects worth of 91 crores. Trust me, this is the need of the hour, so let's know more about it and watch the interview.
So good afternoon, sir. I am More Tanvi from StartupLanes, and we are very grateful to have you on the board for this interview.
Good afternoon. Thank you.
Sir, I request you to please introduce yourself to our viewers, please.
Yeah, myself, Bharatheesh. So I'm a co-founder and director of Mediimpact Healthcare Private Limited, creator of Medpass, India's only health digital wallet. So I come from around 16 years, my work experience in both startup and established companies. Majority of my work towards in the healthcare, mostly on new technology products.
Okay. So my very first question to you is that how did you come up with this idea of startup?
Yeah. See, the idea, as I told, so it comes with around 16 years of experience. So I often used to visit hospitals, labs, and pharmacies for actually for my ex-company works for taking requirements, talking to our merchant for selling that other product. So I always noticed that when patients making payments, they used to ask for a discount basically at a couple of places while making at the hospitals, while at the labs. So they always used to reduce their bill. And most of the people used to reject while giving discount while paying the bill. So that's I actually thought that, and also especially when you're paying a higher bill in hospital, sometimes you need a bigger amount. So they always used to call their relatives, friends to arrange the money. So these are the two factors which come to my mind. One need to help people when the medical emergency need you to help with the money support, which is basically health funding, emergency medical loan basically. And other one is the ensure that on each transaction they get a cashback, basically discount. So in this around I built a business case. That's how Medpass is created.
Okay. So what was the most difficult part that you faced in the initial stages of the journey?
Generally, if you take not only our company, any startup, when you come up with a new idea, when you come up with a product, the set of the difficulties is to get a first customers. Basically, in our case, to get first 100 customers who are basically paying customers, right? So convincing customers, getting them on our platform is one challenge at the customer side. Other challenge also to convince the merchants to come and give a discount to our customer in our platform, because we are new to customers, new to the merchant. So convincing both the part, basically one is the customer side, another is the merchant side. And third part is be difficult. Other part is to ensure the technology works, because since ours is a wallet and it is actually comes with the money transaction. So something goes wrong while paying money, whatever thing. So you have to ensure that should not fail. So both technology challenge one, and also the convincing at the customer, convincing paying customers, and also convincing at the merchant side. So all three factors basically is challenging for us basically. So somehow, and also you have to tweak your marketing strategy. So initially you may do some 10-15 marketing activities. So all will not give you results, right? So you know that which are the you're giving result. You have to analyze the data, do research on that, and try to continue the marketing activity which gives you the results, right? So actually doing there is you have short period, so getting this all to be done, which is slightly difficult part. Were unfortunately good with us, so we could able to get this all the things, and in last 6 months we had a good period processing around 5 crores worth of transactions, and also actually do break even in last month.
So my next question is that as you know, you have an established market. So what was the market gap that you identified?
See, as you take a healthcare, there are a couple of lot of things there. One is basically healthcare delivery, and reaching right information to the right people at right point of time. Right, that is a major thing. So to come up with that, that's why we build this health ecosystem with health funding. So bringing, integrating, developing actually integrated this ecosystem. We brought wallet into picture so that it can actually solve the couple of issues, basically majorly on health spends. So what happens is every time you pay with Medpass wallet, so you save money on each transaction. So you can save the money on each transaction, and the good part is Medpass wallet, it never becomes zero. If you're using other wallet, it's like 100 rupees means you pay 100 rupees. Few may time you may get some cashback, which is not thing. For us, it's like you are paying a 1 lakh bill and you get a 10% cashback. You see, 10,000 you get a cashback. So 10,000 cashback is equal to 10,000 rupees. It's not like 10,000 cashback is equal to 100 rupees. So it is 10,000 cashback is equal to 10,000 rupees. So which is like saving money for yourself, for your health need. So that's what the major gap. You are not able to save the money on your thing. So that's why we identify gap, and we ensure that that money is not utilized somewhere else. If you are using the Medpass wallet, that money can usually only use for your healthcare needs, basically.
Okay. Yeah. So can you explain your business model in detail?
Yeah, our business model basically it's B2B to C. So B2B business to business with our merchants is basically our merchants basically providers who in terms of super specialty hospitals, multi-specialty hospital, labs, clinics, home care services, doctor on call services, and our partner, our the medical loan partner. So this is all business to business. So one side, another is B2C is a customer side. So ours is B2B to C. So what we do is we engage customers to our platform. We engage the merchant to our platform. So both you bring it to Medpass platform, basically. You bring it. So customer can see the merchants and they can see entire the discount part which is available on respect to service. If you use this wallet in pharmacy, you get discount of cashback. You use in hospital, you get this cashback. If you're using in lab, you'll get this much discount. Basically, use in home care services. So basically, they can use a couple of the services which is available. So it is basically B2B2C. So as I told, so customer will get benefited because whenever he uses Medpass wallet, his money is saved on each transaction. And for merchant, it is like increasing their footfall because we bring the footfall to the merchant. So since we bring the both together, our referral some small part of the is involved in. So all three players who involved in this is benefited. And good part is in our model is very good. In any startup you take, you have to spend a couple of time to get a revenue started. Our model is so good that from the first transaction of the company transaction, company gets started getting revenues, right? So that is the beauty of the model.
Okay. So nextly, I would like to know that did your friends and family help you in funding in the earlier stages?
In fact, I not approached friends and family. I approached my ex-colleague who used to work with me. Apparently, he's my co-founder now, Mr. Srinivas. So we used to work with one of the company, Japanese MNC, and so once I got this idea, I told that I went and met him, and that I had this idea. In fact, he was also leaving that job because the company was shutting down. So the right time I approached him saying that I have this idea, so I wanted to implement kind of stuff. So he comes with a lot of experience. So he said that okay, we'll start. So initial funds we approached, then later we approached our our ex-boss, Mr. Sridhar, who is currently our angel investor. Okay. So he has put some initial investment. So that's how it happened.
Okay. Sir, you have ever approached the investors, and if yes, then how?
Investor, of course, our angel investor is, we approached him after once we have decided that we have to go with this. Yes, we approached our angel investor, Mr. Sridhar, who is currently invested on this our company. Yes, we approached him. Yeah.
Okay. Sir, as you know that we are going through an uncertain pandemic since a year. So what are the other factors you see impacting your business in the coming years?
See, generally we are in healthcare, right? So pandemic will not actually affect healthcare. In fact, it's good for
Positive
us
impact.
in a positive impact for us, because the we are used to take a lot of to reach out, right, during this recent pandemic. We are in operation in Mumbai and Bangalore. Okay. In fact, during the pandemic, we have received so much call from across Bangalore and across Mumbai. So otherwise you take a long time to reach people. So somehow, because of the needy, people started approaching us. That is a good part for us. So it's pandemic. In fact, it's helped a lot for us. Yeah.
Okay. So what are the other factors you see impacting your business in the coming years?
In coming years, see, as I told, we are only health digital wallet as on today in India. If at all, if I look at some competition coming in, I don't know, because nobody is there as of now for medical wallet. But of course, there are other online people are there for different services. You will find people doing for pharmacy with their different apps. Somebody is working on the app, but you do not have any integrated with all the services in the form of wallet. In the form of wallet, currently we are only there. So if you expect, we may expect similar to us maybe in coming years, or we may see some competition coming from, of course, in other services. Yeah.
So are you planning to hire fresh talents in your business?
Yes, of course, we like to hire the fresh candidate. The reason being, see, generally, I always suggest, in fact, I also, when I started my career, I started with a startup. So I believe giving opportunity to the freshers, which will actually encourage a lot if you compare to other corporates. So generally, if you start a career in corporate, the learning may become limited because other people, a lot of people there can do parallel other work. But in a startup, generally what it happens is it will allow you to grow. If you are like starting career in a development stage, for example, I take as a developer. So it will allow you to do even testing also, because the limited people will be there. It will allow you to do UX UI design and try to learn. Similarly, if you are starting a career with as a sales executive in any startup company, which is again allow you to talk to the end customer, go and it's allow communication will bring. So communication will improve a lot, because it's talking to everything. Also, you'll talk to the decision maker. Otherwise, he has to always go to with his boss and approach. So since limited people, you will get all that things. He can go and approach senior people. He can actually demonstrate, improve his communication, and also he works in different. If you're not limited only to sales, you can also involved in research, marketing research. You will also be involved in digital marketing. So a lot of opportunity which will create actually when you start your career with a startup. That's why we also recommend and actually more focus to get fresh talents into the company.
So what are the traits you are looking in the fresh talents?
Sorry?
What are the qualities you are looking in the fresh talent?
See, fresh talent, generally now the recent changes came, the freshers. What we believe, when we started our career, so it's like we used to work behind the hours. Currently, you should not come up with the mindset of 9 to 6, basically. So that is in terms of your education qualities are there. Otherwise, you will not get into the company because you have to pass that education. So apart from that, what generally I look into it. So you should come with this mindset of working behind hours, which is needed, and it's for personal growth as well as the company growth. Because when a startup is there, you cannot. Sometimes you have to do multiple tasks at a time. So that will improve your quality of people who actually came for some particular work. It will ensure you can learn other work also. So quality, you should be ready to accept the task whichever comes in with respect to their working area, and try to help the organization so that you can also grow along with the company.
Okay. So according to you, what are the personality traits of a good leader?
See, good leader is actually defined in many ways, right? So good leader, in terms of my good leader, I define a good leader like in many terms, like good leader who's actually stand with the team, help the team whenever is necessary.
Mhm.
Also take a right decision at the right time, uh, and also be ready for the hiccups which will happen in the company. Right, you have to be ready for not only for good thing, also to parallelly prepared mindset for bad times also.
Okay.
And good leader is always actually work with the team, go ground level. If somebody is rather pushing him, he try to identify a problem and support with whatever why he is struggling for whatever for his work. Try to help them. Try to understand the employee now at this personal level also, because couple of times they only focus on work. They don't know what's happening in the behind. So sometimes they're not able to deliver because of the issue is for something somewhere else. So you have to be ensure that you talk to your employees more often directly and try to understand the issues and work along with the team. So it is like sabka saath, sabka vikas kind of stuff. Yeah.
Yeah. Sir, if you're talking about leadership, I want to know that what is the good part and what is the bad part of being a CEO?
See, of course, little different question. Yeah. So good part of a leader, generally, a good part is one which I generally liked in my position is you can actually implement what is there in your mind. Now, all the way my 16 years, of course, if you want to implement, you use a lot of approvals, mind pressure, this and a lot of issues there. But here, actually, you can implement what is there in your mind. There is no immediate but as such. Of course, you have to parallelly report to the investors and other stuffs. But on major decision, you can implement what is there in your mind, what you actually like to do, that you can do. In other, if you are working for someone else, it may not. You have limited decisions power. Here, you can take the decision and implement what you actually would like to implement. That is good part as part of the CEO. So bad part is, of course, once you implement it, say, whatever comes, you have to be ready to take that burden on
Challenges,
challenges and other stuff. So that may not be a bad part, but it's part of the functionality. So yeah, you have to be ready for taking all the stuff and ready to face difficulties, ready for everything.
So describe a time you had to make a tough decision, for example, budget cuts or organizational restructure or etc.
See, our the major tough decision was actually when we started, all this happened, approach investors and all money has come, we started building it. All of a sudden, the wallet partner, co-branded partner, which we actually wanted to go with, had some issues, and all of a sudden they said that they cannot go with us because they have some issues. So then we were like 2 days we were very blank, so we were not doing. Then we made a decision to go with our present co-branded company, and they actually wanted to take approval from RBI to support this kind of a program because it's new, right? So getting approval for new program, especially in a wallet, is slightly tough. So convincing them, saying that this model can be used in for health and under the wallet. So getting that company has to get a approval from the RBI, Reserve Bank of India, for supporting this kind of a wallet program. So initially to convince them to get this going along this project was actually the tough decision to actually change the partner because we do not have any choice. And that was a tough decision when we made a decision to go with this partner.
Okay.
And how this helped actually, in fact,
what did you do for it and what are the results now?
The results actually, in fact, so that time it was tough decision. Now it is actually resulted in many good features which is enabled because the integration what we planned with the earlier partner and the integration how we with the new partner was slightly different, which was because we had 2-3 integration, separate integration. Because of that integration, which has allowed us to do a lot of work by ourselves. Because, for example, if you want to do a refund, if money deducted from the bank, not added to your wallet, so it is enabled us to do quick refund from our side. So with earlier that direct this one was not there because that was the integrated platform. So this is one of the good feature, and also the settlement part. So if you need immediate cash, you can do the settlement. It's given actually a lot of feature because we are tied up with one of the known number one integrated partner. So which is allowed actually a lot of feature for startups where actually you can use whenever you need it. It was a tough decision, but it resulted in very, very good for us.
Okay. Sir, are you looking for any vendors to simplify any part of your business?
Vendors, we already outsourced a couple of work with the two vendors. In fact, we are outsource our legal finance part is actually outsourced, and part of our development team is outsourced. So, in fact, we are already working with couple of vendors. In fact, we are going with a couple of vendors for our company valuation vendors thing which already doing. So yes, we encourage that. Yeah.
Okay. So lastly, I want to ask you that what are the recent and long-term plans for your business?
So recent plan is we are going for funding now. We are going for funding. Parallelly, we are getting our valuation done for the company. So immediate what is to get a fund, and the long-term plan is to expand our services across India, not only at the major cities, but also at the tier B cities as well. So we want to reach out couple of cities and expand our services, and also we want to create a lot of jobs, and we want to ensure that people save money on each transaction when they spend for their health. So that is actually the good part. So we want to reach more people so that you can save a lot of money for them. So and all, that was longer plan short.
Okay. So lastly, if you want to say something to your viewers, our viewers, it would be great.
See, our viewers, basically, I would like to support our initial customers. We have now around 700 paying customers, 700 plus paying customer, repeat customers, basically. Who I actually thank in this form. I want to thank them. I want to thank all our merchants. That day, Medpass was nothing. So they trusted on us, given a chance to being a partner with us. So I would like to thank our merchants, our customers. Moreover, I would like to thank my colleagues, who are all my ex-colleagues who joined us for a very less salary to support for this cause. So I want to thank entire my colleagues, our partners, basically our co-branded partners, our technology partners, everyone who has supported us. And for viewers, if you are in Bangalore and Mumbai, please try out Medpass services. I hope we can able to give better services in healthcare thing. So that is what I would like to request the thing. And also thanks for StartupLanes for this opportunity as well.
Yes, very welcome, sir. Thank you for your time and crucial words. Thank you so much.
Thanks much.
Yeah.